Good morning. It's Wednesday, April 24th, and this is a joint committee hearing with the Education and Culture Committee and Health and Human Services Committee. I'm Chair Will Jawando of the Education Committee, and I'm joined by my colleague, Chair Albornoz of HHS, and the members of both committees, Councilmember Lukey and Councilmember Sales and Councilmember Mink will be here shortly. Today is the second of two joint EC-HHS sessions. Previous one we had last Friday. We've upgraded our digs since the last meeting, so thank you all for coming back, and we have a little more room. We covered the newcomers initiative and some of the HHS EC CIP items. Today we will continue that review of the operating budget for items that are designated for this committee, specifically the early care and education non-departmental accounts or NDAs, including early childhood services, child care subsidies, the Children's Opportunity Alliance NDA, Head Start, and pre-kindergarten services. We'll also discuss linkages to learning, school health services, high school wellness centers, and bridges to wellness in the high school cluster projects, and public-private partnerships for the cherry on top. These are, as I said last meeting, these are some of the top priorities in our government, the services we provide for our youngest learners, for our families, and we know youth mental health is at crisis levels. We know that we need to expand early childhood education rapidly and make it more affordable. So these are big items, and we're happy to jump in. So I'm going to turn it to Ms. Yao momentarily, but we'll structure this. We'll do the ECE items first, the early childhood items, then we'll do school health services, and then we'll talk about partnerships. And so we can hear updates and then pause for questions or we can hear the updates and presentations about all of them, and then we'll dive in to questions. Councilmember Albornoz, nothing to add, so we will jump in. Ms. Yao.
Good morning. This morning, you're going to first receive an update on the early care and education system update from Department of Health and Human Services, Montgomery County Public Schools, and the Children's Opportunity Alliance.
Wonderful.
Okay.
Yes, if you could just introduce yourself as you speak, that would be great. Thank you.
Sure. Buenos dias, Jennifer Arnaiz, Administrator of Early Childhood Services, DHHS. So if you could start the presentation.
I'm waiting for...
Okay, I'll go ahead and get started while you figure that out. Okay. So again, buenos
there we
dias.
go. We have it.
Okay. All right. So before we start our presentation, Early Care and Education Initiative and the Early Childhood Services work, I wanted to ground us in really the system and recognizing that the ECEI is part of a larger system of early care and education. And we acknowledge the diverse stakeholders that make up this system, from our partners, our families, practitioners, our community advocates, our influencers, as well as our public agencies. All of us have a wide responsibility in terms of shaping the system. We understand and acknowledge the vital importance of collaboration within this greater system, and our focus for today is to talk about the piece that the Early Care and Education Initiative contributes to this larger system. Next slide. So today we want to bring just a grounding again of what is the Early Care and Education Initiative. The ECEI, as it is known, is really a collaboration of public agencies from MCPS, Montgomery College, and DHHS, as well as the Children's Opportunity Alliance has been included in this past year, to look at the programs that our public agencies are providing to our community in this realm. We emphasize an importance of aligning all of our tenets, which are sustainability, access and affordability, expansion and workforce, through alignment and data. We also emphasize the importance of the coordination and collaboration of the work that we do. I did want to acknowledge the Council's letter from November and express gratitude, really, for the emphasis on enhanced collaboration. Our collective response was sent to Council, I believe, last week in response. But I wanted to highlight a few of the items that we are working very strongly on so that we can do our best work. We have decided collectively that we needed we were going to consult with a third-party vendor to help us in really establishing roles and responsibilities between programmatic supports and the greater policy decisions that are made in Montgomery County. As influences within this design, we recognize that there are many elements that overlap with each other, and so clearly defining our roles and responsibilities, as well as being transparent in the data that we collect and being able to show that to our community as well as others is primary for us. And on the topic of data collection, I am pleased to say that data sharing agreements are being finalized now between DHHS as well as MCPS. This ensures that data sharing protocols are in place. We've done a deep dive on collection needs, evaluation efforts, all in accordance with our county protocols as well as MCPS policies regarding data collection and sharing. So today, really the presentation you're going to see and hear, is going to really stress the continuous collaboration that we have taken on this year. We're continually learning in this realm and seeing where we can maximize our best assets and influencers to be able to support our community in this realm of early care and education. We do have a shared vision and commitment to the growth and evolution within this system. So before we go further into the activities that we have done this year, as well as highlighting the activities we plan for FY25, I wanted to hand it over to my colleague, Ms. Lambert, so she can talk a little bit about our spending plan and the finances within early care and education.
Good morning. Deborah Lambert from the Office of Management and Budget. A word about the process for developing the spending plan for the Early Care and Education non-departmental account. The Early Care and Education Initiative work groups met last fall, and these work groups involve stakeholders from schools, the college, Children's Opportunity Alliance, as well as HHS, to provide recommendations that have fiscal implications for the non-departmental account. Those recommendations for spending were vetted and prioritized by the Finance and Budget Committee of the Early Care and Education Initiative. And the result of those efforts is the fiscal year 25 spending plan for the non-departmental account for early care and education. So just to highlight some of those components of the spending plan, and council staff will be going over that in more detail later in the presentation, but we like to take a look at spending and its impact and how that informs our decision making. So for example, taking a look at the impact of the Working Parents Assistance and the supplement to the state's child care subsidy program, we're anticipating spending in fiscal year 24 of about $4.3 million to serve 436 for working parents assistance, and 851 served by the supplement to the state subsidy program. We anticipate spending a little bit more on this program in fiscal year 25, and you can see the results that we will have an increase in the number served by working parents assistance as well as the supplement to the state subsidy program. The next line item is the Infant and Toddler EquiCare Grants Program that provides subsidies that cover the full cost of high-quality infant and toddler care for families with incomes up to 400% of the federal poverty level. We are anticipating spending $2.2 million on the program in fiscal year 24 that will fund 75 infant and toddler seats. We will roughly double that program in fiscal year 25 to provide for 150 infant and toddler seats. The next item, family involvement centers. We currently have 3 of those in fiscal year 24. We anticipate having 5 in fiscal year 25. So the number of children served by that program, we're spending about $700,000 in fiscal 24 to serve 528 children. We expect with the addition of the 2 additional family involvement centers in fiscal 25 to serve 880 children with these services. The next item, Quality Child Care Development Center. Here we anticipate providing a match to a state bond bill that will allow for a provision of a center in Gaithersburg that will provide an additional 80 to 100 seats to open in the zip code 20877.
Just pausing on that, that's Quality Childcare that's in Silver Spring. Is this the
No,
same vendor?
Gaithersburg.
Different vendor? Okay, but a private vendor that's getting a state matching, okay, got it, thank you.
Okay, and the next item is preschool contracts for 3 to 5-year-olds. In this initiative, we expect to augment that contract by $840,000 to increase the seats from 100 to 150. And then we have our SNAP program for fiscal year 24 that provides $227,000 to serve 15,000 children food for summers as well as winter breaks. And in fiscal 25, with the leveraging of the state funds as well as federal funds, we expect to serve almost 72,000 children, all ages, with food over the summer as well as winter break. The next item, again, taking a look at the impact for these expenditures, the Go Family Child Care, recruitment of family child care providers is expected to provide 206 new seats in fiscal 24. And with a little bit more spending in fiscal 25, $147,000 will provide 400 new family child care seats. And then the final item that Ms. Arnaiz has already mentioned is an $85,000 expenditure that will help us define the roles and responsibilities of the Children's Opportunity Alliance, MCPS, as well as Health and Human Services for how the partners are going to be working together to promote early care and education in the county, and that we expect to spend this amount in both fiscal 24 and fiscal year 25 to do that essential collaboration work and to define those roles and responsibilities. So these are just some of the items that we wanted to highlight and in terms of impact of our spending plan.
Okay. During FY24, we accomplished significant milestones within 2 pivotal studies that I wanted to share. The first one is our shared study survey. This is an activity that began in FY24 and will continue into FY25. This year, we conducted several interviews, focus groups, and surveys with child care owners and administrators. With their assistance, we co-designed an approach to how to reduce costs within the child care programs. The owners and directors prioritized input to help us understand the critical areas of business sustainability. The proposed phase that we have concluded is a tiered approach focusing on marketing support such as staffing, HR management, bulk purchasing, and software utilization. In FY25, we propose to release an RFP so that we can implement these strategies by contracting a vendor to oversee a shared service program. The second study was our Child Care Facilities Fund. Within this study, we've identified the challenges through discussion with stakeholders, again through focus groups and interviews with child care programs in Montgomery County to really look at where the challenges lie in terms of quality enhancement as well as expansion. What was concluded was an initiation or an establishment of a Child Care Facility Opportunity Fund. This is designed to provide financial resources as well as technical assistance to child care programs. The funds aim to support expansion and enhancement to facilities prioritizing licensed family child care programs, Excels rated programs, as well as underserved communities. The primary supports will be technical assistance, and we expect to release an RFP in FY25 so that we can have a variety of options for our providers to be able to access these funds to be able to enhance their programs. So, these studies mark a significant milestone in our journey towards ensuring accessible, high-quality childcare for all our families in our community. Next slide. So, access and affordability. I'm excited about these two transformative initiatives that we have engaged this year. These really are reshaping the landscape of childcare in Montgomery County, as well as client services. The first one is our EquiCare grants. Ms. Lambert had mentioned that this year we had initiated the grant for 150 seats, and we are going to double that for FY25. This innovative subsidy model really addresses the financial barriers for families. It covers 100% of seat expenses for families below the 400th percentile of the federal poverty level. It also prioritizes families who are unable to access Child Care Scholarship or the WPA program. Both of those programs are geared towards families who are working. There are many situations in this county where we have families where there might only be one person who is working. And so this allows that infants and toddlers have an access to high-quality child care programs. Programs were able to apply for this grant. They had to meet certain requirements, such as highly rated Excels to be accredited, and we also reviewed teacher credentials. So we finalized this grant, this first round, and I'm pleased to say that as of yesterday, the programs were notified. Out of 22 applicants, 14 were selected for a total of $2.2 million. That's 150 seats, and then we will be releasing this grant again in July so that we can expand this for our infants and toddlers. One of the questions that we receive from this program is why focus on infants and toddlers. Infants and toddlers is the most expensive in childcare. It is also the hardest to find in Montgomery County. So we were able to prioritize this with several efforts at the state level focused on preschool. We felt it was our obligation to really look at the infant and toddler population. The second groundbreaking activity that we had done is our streamlined client access to benefits. The community portal really it's a digital platform. You've heard from several other HHS sessions about this 24/7 access to access record updates and application tracking for services. It was very intentional. The first three services to highlight were focused on of what children are touching. For example, working parents assistance, rental assistance, and health programs. We contributed funds to the development and testing phase for this platform. Future enhancements are planned for FY25 with an estimated release for July 1. So these initiatives highlight the commitment to innovation, efficiency, and meeting diverse community needs. It emphasizes the transformative impact of these initiatives on reshaping child care programs and client services.
Good morning, everyone. Nichelle Owens, Director for the Division of Early Childhood and Title I in Montgomery County Public Schools. This slide highlights our expansion during this current year. And just big picture, you will see if you were to add the two numbers together, MCPS is currently serving approximately 4,884 3- and 4-year-old children in our district. Starting with our youngest learners who receive special education services, we do see an enrollment of about 2,000 children, and that is a 5-to-8 ratio of 3- and 4-year-olds. These numbers reflect part-day and full-day programs, and as previously shared, our numbers for children receiving special education services is based on need, not recruitment. So it's important to make that distinction, that the growth that we see is indicative of a growing need for services within our district. Shifting to the second table, students enrolled in our income-eligible early childhood programming. We see enrollment and capacity for children in both Head Start and pre-K. Our total capacity for this year is 3,163 seats, which includes both full and part-day seats. Drawing your attention to the last column, you'll notice high percentages of seats filled, especially among 3-year-old seats as well as full-day seats. And of course this makes sense because that's what parents prefer. Our part-day seats are 82% filled. And during the registration process, what we have learned is that parents communicate that they prefer the full-day seats. However, when they have to make decisions as to what's closest to them versus full day and what's available, they will accept a part-day seat.
Just before, can you go back? I just want to make sure everyone
Sure.
understands the slide. Thank you. So in the top part is pre-kindergarten special programs related that are not income related.
That's correct.
So in that category, MCPS is serving 2,003 students,
Yes.
plus the 2,881, which are for the income related, correct?
Yes.
So on total, MCPS, and this is always dangerous when I do math, but 4,884 students is what I get, that MCPS. Okay, good. So that's the total number of 3- and 4-year-olds that are being served by MCPS for early care and education.
Yes, right now.
Got it. All right, and then just, I want to, you can do your math now, we'll come back. I want to make sure, because one of the things that I get from public, and I just, how many, what's our number in the private provider space? So that we can have a full number and
Of
have to understand it.
preschool?
Yes.
I'd have to get back
3
to you.
and 4.
I can tell you there's a total of around close to 40,000 childcare seats that are licensed in Montgomery County. I have to get back to you on the breakdown for 3
That's
and
for
4.
all ages, though, right?
All ages, yes.
Right,
I'll
so
get
that
back
wouldn't
to
be
you.
3 and 4.
No, I'll have to get
So
back
let's
to you on
break
that.
that out and let's get that number.
Okay.
But so it's less than 40,000 because some of those are babies.
Correct.
Right? And still important, of course, but just trying to get the numbers. So it would be somewhere south of 45,000 young 0 to 5 are being served in Montgomery County right now, if you add the two numbers,
Yes.
right?
Yes.
Okay. And what's the total population of that age group in the county?
I'd have to get back to you on the total number
Okay.
I know the under 5, I believe we're at
Yeah, that's what I mean, under 5.
under 5, we're at 70,000?
If someone could get that number. I
Yeah.
just think it's important to frame as we set our goals and what we're trying to, the goal here is to, go ahead.
So I got my staff
Okay.
behind. It's about 11,000 per age group.
11,000, that's what I thought. Okay, so about 11,000 from 0 to 1, 1 to 2. Okay, so that's
Correct.
55,000, right? And roughly, am I doing my math right there? 55,000 children aged 0 to 5. Or probably a little more than that, right? Probably a little more.
75,000, 13,000 per age band, 11,000.
You gotta come up.
Okay. Could you come up? I don't know, who is that? Okay,
Phoned a friend.
yeah. I just think this is important to understand.
Laura Jerome, Manager of Strategic Initiatives for the Children's Opportunity Alliance.
Okay, great.
There's roughly 75,000 children 5 and under in Montgomery County. For each age bracket, band, there we go. It's about 13,000. And
So 13,000 0 to 1, 13,000 1 to 2.
exactly.
Got it. Okay.
But generally, only about 80% of families choose to enroll their children in public school. That's
Right.
why the kindergarten class is about 11,000. Otherwise, they homeschool, they go to private
Right.
school.
Right.
So when we're thinking about families that would opt in to a program
Right.
like this, it's about
So that's where we're getting
11,000.
the 11,000 number, because we know
Yes.
there's obviously drops. Okay, so 11,000 times 0 to 1, 1 to 2, 2 to 3, 3 to 4, 4 to 5. So that's the 55,000 that I was using, right? I think, right? So, because the other 20,000 are at home, because that's 80%. 20, we're doing good math here today. This is, we're modeling what we want our students to do. So there's 55,000 students that around there that would be eligible and interested if a program was available and affordable. And between MCPS and the private care providers, there are 45, just under 45,000 slots. They're not all filled. They're not all affordable. Go ahead.
But I would say, sorry, the Kimberly Rusnak Children's Opportunity Alliance, the 40,000 seats that are community-based childcare seats are actually range from birth to age 12.
Okay.
12, right, or 13. So it could be,
Okay.
childcare providers can provide services for any of those ages.
All
So
right.
it's not segregated or separated by age.
Okay, so we should try to narrow that, like, we need to get a sense of that. I just, I know we had talked about this demand study, and I know that'll be something maybe you'll bring up here, but I just think we all need to have a real crystal clear picture of the need, what's available. Obviously, we know what's available is not affordable, and we have other issues within what's available, but let's at least start with that. So thank you for that, and I just wanted to pause because I feel like this was a good, but we know the MCPS portion is just south of 5,000. The private number is 40,000 slots available, but it could be, as was just brought up, age 0 to 12. So I just asked that we need to get a breakdown from what the 0 to 5 is. And I'm sure that's something we could get
Yes.
from the providers, I'm assuming. Okay. Go ahead. Continue. Thank you.
Sure thing. Next slide, please. So in the last slide, I shared the number of part-day and full-day seats by Head Start and pre-K. As I mentioned, most of our Head Start seats are full-day, but that's not the case for pre-K. What I wanted to do is for us to isolate pre-K and take a look at some trends since 2019, 2020. Remember, this is just pre-K, okay? And I like viewing the data this way because it shows the balance of how pre-K has shifted. And with requested funding for next year, MCPS has a chance to add even more full-day seats. So if we take a look at this slide, you'll see the blue line represents part-day seats, and you see where it falls in 2019, 2020. And now you see where it has the potential to fall in 24, 25 with funding. And then you can take a look at the orange line, which shows full-day seats. And that is it's going in the opposite direction. And we've done this by increasing our footprint of seats overall, but also converting part-day seats into full-day over time. And this has taken a lot of work for our team and our teachers and our paraeducators and our principals, and we're grateful for that. We do believe that by converting these seats to full day, we will be able to serve more of our children. Last year, we did use Title I funds to convert our part-day seats to full day in 10 classrooms in identified Title I schools. And I'm pleased to say that those seats are filled this year. So there was no issue in filling them. As soon as they converted, we were able to fill them. The right side of the slide presentation shows the same data, but just by classes. It's just a different way of looking at the data. And it shows how we've increased the number of full-day classes. And since I've been in this role about 2 years ago, we've watched this data take a dramatic shift, partly because of blueprint funds, which were used in 22, 23, and as I mentioned, last year we used Title I funds. So our commitment to full-day seats is meant to prepare our children for kindergarten, especially our 4-year-olds, for their kindergarten experience and beyond. And budget pending, our hope is to continue reducing our part-day seats to 0 in future years. Next slide, please. For this slide, I'd like to highlight the collaboration that was mentioned earlier. And I'm really excited to highlight this. This has been a big part of my work. It's new work for me, and I've enjoyed it quite a bit. So on the ECEI, we have taken some intentional steps to expand state-funded, community-based pre-K programs and seats. And these efforts showcase our commitment to expanding access to pre-K opportunities. And our hope is that these efforts will yield benefits in FY25. So I want to start by emphasizing our collaborative efforts within ECEI. I believe all of us, Laura and Kimberly, not Kimberly for this particular work group, but Jennifer and myself, we serve on the Pre-K Public and Private Partnership Work Group. And this particular work group is intended to increase the number of pre-K private providers who take advantage of state-funded opportunities for pre-K. And in doing this, we've been able to clearly define our roles and responsibilities just for outreach, technical support, implementation, data gathering, and advocacy, again, with the intent on expanding our footprint for pre-K and our community-based partners. So our work has resulted in the development of a document where we really map out how we start with awareness, and then we shift to outreach, and then we engage in advocacy, and that's primarily done by the Children's Opportunity Alliance. Then we shift into a more of a technical assistance role, and that will become part of the work of DHHS. And then finally, once a private provider becomes a partner, then they're handed over to MCPS, where we provide support and technical assistance as well as professional development. And also leveraging our collective strengths between the three groups, members of this group have been instrumental in hosting town halls and facilitating town halls. We actually had one last week. And the whole point is to share the benefits of state-funded pre-K among our child care centers as well as our family child care centers. Again, our main aim with this collective work is to ensure that MCPS has partners in the work, that there's pre-K access in private settings. So taking a look at the next column for growing opportunities in family child care, we know the importance of family child care in programming, and we want parents to have choices, right? MCPS is not the only choice. It's the team I cheer for, but I also recognize that there are other options for child care. So DHHS continues to lead the work of family child care recruitment efforts. Their anticipated projections indicate that FY25 will once again exceed their established goal of 400 seats in home-based settings. And to uphold the success of previous cohorts, DHHS will spearhead launching our own series in FY25. These series will concentrate on nurturing leadership qualities among participants, aiming to mentor and facilitate professional growth for family child care providers. And the results from FY25 show that the successful launch of Growing Our Own, the successful launch resulted in 206 seats filled and 371 seats in process. HHS has set goals for FY25, and they are aiming to recruit 50 new programs, resulting in 400 seats. And then the final slide is where we highlight the work of our Children's Opportunity Alliance, and they're continuing on their pathway to pre-K partnership, the pathway I mentioned earlier. COA has provided funds to establish a hub approach with the Family Child Care Alliance and the Maryland State Child Care Association. This hub model draws from the Alliance's effective work with family child care, aiming to replicate its success to the needs of child care centers. Currently, there are 5 selected centers that have met requirements and have received comprehensive application and management support. And they are also our partners in our pre-K expansion. For FY25, 5 centers will receive administrative support, and 4 will receive grant writing support only. Did I get that one right? Okay. This is critical in maintaining our partners for pre-K expansion. Family Child Care Centers has expressed a need for this type of support in writing, implementing, and fulfilling reporting requirements for the grants. And those grant reporting requirements are, it's a lot. It's a lot for my staff, so I can only imagine if you're running a private family care business what it would be. So we appreciate having that type of technical assistance and support. So overall, for MCPS, as we look forward to these efforts resulting in more pre-K partners, MCPS will continue to have our pre-K private partnership teacher who is assigned to supporting our pre-K partners in their work. And specifically, she fulfills the role of, or the requirements of Blueprint requirements. And she does this by supporting our approved partnerships and working with diverse students, student groups, including students with disabilities, students who are impacted by homelessness, and emergent multilingual learners. So at this point, I'm going to hand it over to Ms. Lavina from Montgomery College.
Thank you.
Great day, everyone. My name is Lavina Nash Della Rosa. I am the interim department chair of education at Montgomery College, and I'm happy to be here today. And today I have the privilege of talking about how we are preparing and training and supporting our workforce in this program. So at Montgomery College, we have about 103 students who are receiving support from the ECI program, 30 in the AAT program for early childhood education, 35 in the AAS program, 19 students are pursuing CDAs, and another 19 are pursuing one-year certificates. So the ECI program is significant in assisting these students in achieving their degree programs. Among those students, we have about 51% who've exhibited about a GPA of a 3.0 as of the winter of this semester. This number definitely showcased the profound dedication that our students have to education as well as the well-being of Montgomery College's children and families. This also is a testament of the work of our program coordinator, who provides advising and significant monitoring of these students, providing complete I should say, like well-rounded support to make sure that they are able to get through the program in sufficient time. We also have 31 dual language learners in our program. Our ESL program supports these dual language learners to help them achieve significant success. And our goal with the use of the ECEI funds is support these dual language learners to satisfy the requirements of the English language classes that are required for their degree programs. So we are actively working to, if you will, jumpstart their work. They'll come in the ESL programs, and helping them to navigate that program quickly and successfully so that they can move over to credit classes. We are expecting in the fiscal year 2025 to actually expand those supports to provide summer and pre-placement testing jumpstart programs, not only for ESL students but also students who are in math, to support them in joining the credit-based programs for our AAT, AAS programs. We're also looking for, at Montgomery College for fiscal year 25, is expanding our support to our alternative certification programs, specifically the Early Childhood Alternative Certification Program, which is a program that provides an opportunity for educators or for students who already have degrees in other programs to go through an accelerated program to become early childhood educators. And this is about an 18-month program and serves as an alternative pathway to get our educators into the centers very quickly. The other things, we are also working in collaboration with the DHHS and their efforts and work to provide professional development opportunities for our educators. And DHHS provides a diverse array of MSD-approved options. And it's not only just professional development, which includes classes and workshops, but also conferences that are offered either free or at very low cost. These efforts are ensuring that professional development is within the reach for all of our dedicated educators. DHHS is committed to breaking barriers to education. So through ECEI, it has become possible to offer immersive classes to enriching the conferences and exciting communities of practice dedicated to fueling the growth of the child care communities. This year, DHHS has empowered our child care communities with 194 learning opportunities. And as a testament to this commitment, they have awarded almost 4,000 cost of knowledge certificates to early childhood care educators, elevating the standards in those communities and as well as expertise across the board. They're looking forward to, in fiscal year 2025, releasing a RFP to delve deeper into the intricate landscape of wages and turnover within the early childhood education community, gaining critical insights into the backbone of our workforce. By leveraging this comprehensive information, our public agencies will be poised to make informed decisions and strategic investments into what we can do to elevate the early childhood education workforce. The study will also embark upon us in transformative journey that signals our united commitment to nourishing and sustaining a thriving early child care education workforce. So we are working on both sides to not only support and provide well-qualified and certified educators, but also providing the supports that they need to stay within practice and to also stay abreast of the current educational pedagogies and the opportunities for the students.
Thank you. Thank you very much. Children's Opportunity Alliance, last but not least.
Good morning, everyone. I'm Kimberly Rusnak, the Executive Director of the Children's Opportunity Alliance. So for the past 10 months, the Alliance has really been focused on our first-year priority of our Foundational Action Plan. Everyone sitting in front of you today at these tables is on our board, so when I say we, I am referring to the collective, all of us that are working together to do this work. And one of the key values that came out of our Foundational Action Plan was synergy, which we are defining as, the fact that we value the many perspectives, expertise, and abilities of early childhood leaders across the public and private sectors, and recognize the shared responsibility we all have to work together on behalf of our community. So for the first few months of this fiscal year, things were a bit slow as we did not receive our first payment from HHS until October. We had kicked off the strategic planning process in July 2023, and we partnered with School Readiness Consulting, a local early care and education strategic planning consulting group, to assist our board as we dove into some of our key strategic questions. Through the planning process, we engaged in multiple community listening sessions and conversations with key stakeholders and partners, and worked hard to get the entire board working together towards this foundational action plan. As an independent nonprofit, it was critical that we take some time to develop our organization's mission, vision, and values. Those are driving items that will create our identity and will continue to help us stay centered as our work moves forward. As all of this planning process was done, we kept in mind how important collaboration and synergy are to the work and to the community. We involved all key stakeholders along the way and asked for feedback at multiple points from our board and others in the community. Through our planning process, we narrowed our actions down to 6 main tools that you see on the slide in front of you. And it also shows the results that we are working to achieve and our larger mission, our larger vision we are working to achieve. So as you look at this and compare this to the work of the ECEI and their framework, some of the results are the same and some are different, and we were intentional about that. The Alliance Board lifted up the importance of leveraging data, supporting the workforce, boosting resources, and driving advocacy to build the ECE system. We believe that we are all part of the ECE system and that we are all part of systems building in Montgomery County. We are all focused on collaborating and sharing information amongst ourselves and with the community. We also realize and acknowledge that the ECE system has many players and stakeholders, even beyond those represented in front of you today. We know that the ECE system has early care and education programs and providers, families and parents, associations, nonprofits, and advocates, which you saw represented in the visual earlier in the presentation. One key element that we all agree on is that children should be centered in all of our work moving forward. So here are 3 short examples of some of the work that the Alliance has done during the last 10 months, and it will demonstrate how we are working to collaborate and partner with others in the community. The first example is related to state-level advocacy. So during the most recent Maryland state session, we've been active in partnering with key stakeholders at the state level, such as the Maryland Family Network, other child care associations, as well as meeting with members of the Montgomery County State Delegation to advocate for change at the state level. We also attended the evening in Annapolis for Maryland Child Care Advocacy. We testified regarding multiple bills that are in alignment with our needs in the community and spoke up about the importance of fully funding the state child care scholarship. The advocacy work spanned various categories from access and affordability to expansion and workforce. And we were very happy to see that HB 1441 was passed, which supports encouraging career ladders and a hub model and multiple other pieces that will impact blueprint implementation moving forward. A second example is related to leveraging data. So our county legislation states that we are to lead with transparency and make more data publicly available so it can be used for decision making. As Jen Arnaiz mentioned, we have signed now memorandums of understanding with both HHS and MCPS, so we will be getting data soon. And one of our asks for funding for next year is to build out the data dashboard using that data we will be getting from our partners. One of the other pieces that we are working on is fiscal mapping. So we are also working with HHS and MCPS and community partners to have a fiscal map for both fiscal year 22 and 23 that should be done hopefully by June of this year, and we will be able to share that with you, and hopefully that will lead us to some insight of recommendations moving forward. The final example was referred to in Nichelle Owens' slide when we were talking about the hub model that we have worked on. So what we did was we started with research. We started talking to partners in child care centers in Montgomery County, figuring out what is working and what is not working with blueprint implementation and outreach and all of that. And so an idea that came from that work was the grant writing and grant administrative support. And so we put out a call to child care centers because currently child care centers do not have access to that type of support. Family child care providers do through the Family Child Care Alliance, and so we were specifically targeting child care centers. We heard from 16 centers that were interested. Through the application process and conversation, we narrowed it down to 5 who are getting both the grant administration and grant writing support. And then there are 4 who only wanted grant writing support in order to get them moving forward. And so those applications are due at the end of this month. So soon those applications will get in, and then they will hear by the beginning of June whether or not any of those new child care centers have been selected to enter into the Blueprint pre-K expansion work. So all of these examples, I think, show a good description of how our work will move forward in terms of conducting research, using data, engaging stakeholders, encouraging greater advocacy, and innovating around how to do things differently so that we can strengthen our early care and education system. We know that it will take greater investment and continued collaboration and a lot of hard work to build one of the best early care and education systems in our country. The Alliance has had other successes related to fundraising, coordinating and convening, grant making, and developing a racial equity and social justice statement and policies that are influencing all of our work moving forward. In fiscal year 25, we plan to develop a countywide common agenda, continue to convene community stakeholders, and gather and share information, continue to research best practices, and expand our advocacy work, and generally support a diverse board to center around systems work and collaboration, racial equity and social justice, and increase community outreach. Thank you for your time this morning, and I will turn it back to Jen. Are you closing?
One more.
I think we were done with the slide, right? Or was there
There's
one
one
more
more.
slide? There's one more, okay. There you go.
Okay, so thank you
Last one,
very
too.
much for this opportunity this morning. Early care and education, the system, what's next? First, I wanted to acknowledge our achievements. I think recognizing the remarkable results achieved through our collaboration efforts speaks for itself. I want to express excitement about the impactful projects that we have undertaken collectively, each of us utilizing our skill sets and our strength to be able to provide services for our jurisdiction. Second, I want to recognize the ongoing work, acknowledge that there is more to be done. We realize this. We want to emphasize the importance of sustained collaboration for alignment within the broader early care and education system. We do have two very large studies that will be released in FY25. They have been mentioned already, the supply and demand study, as well as our cost of care. These two influential studies will help to decide what next steps we will take within this system from the government's perspective, from private sector perspective, and for advocate perspective. I also want to recognize the state. The state has been a true collaborator this year in sitting at the table with us, looking at the work that we're doing, and modeling much of what we're doing in Montgomery County throughout the state. Third, I want to express our commitment to future collaborations. We are dedicated to aligning our efforts and maximizing our community impact through coordinated actions. We welcome future collaborators as well, such as other stakeholders, such as Montgomery Moving Forward and Action in Montgomery. As we focus on our public programs, I want to highlight the initiative's focus that these are direct services to our community. Our commitment to leveraging these collective resources and expertise to enhance access and availability and quality of services is our primary objective. We elevate our concerns so that we can see what impactful decisions can be made at the COA level when we look at our state system and our county system, as well as advocacy. Our aim is for a positive outcome for all stakeholders involved. And again, reinforcing the commitment to collaboration and improvement within this design is our primary objective. Thank you.
Thank you very much. Thank you to all the partners and all the work that's been done in the last year. So I'll kick us off with just a question or two and then turn to my co-chair and then colleagues who I'm sure have questions. So you mentioned the letter we sent you in April. I appreciate you also that asked from the chairs, co-chairs asking for updates and around the timeline and facilitation and coordination. So thank you for sharing some of those. The initiative has carried over money each year, right? Since it began in 21. And obviously some that happens for various reasons, but this year it began with 11 million and the FY25 recommendations for another 11 million. Could you talk about how you expect to have the capacity to carry out the spending plan, which is projecting $27 million in spending, and that's more than twice this projection for last year. And then also, I think my reading of this, and Ms. Yao, you can correct me if I'm wrong, but the spending plan outpaces the current recommendation if you were to go along with it. But I'm going to let you speak to that.
Yes, I was actually going to walk us through
Oh,
kind of the
please.
adjustments and everything.
Walk us through.
I didn't know if you wanted to ask about the presentation first before we leap into the budget aspects of.
Well, I'm eager to get to the budget. I think my colleagues are, but I think because it connects to the presentation, so I think we'll. But if you want to, tee it up for us, but just incorporate. That's going to be the first question.
Okay, all right.
So, go ahead.
So, as the chair expressed, the executive recommends $11,260,344 for the NDA in 25. It's an increase of $185,937. The projected unspent funding of $11 million in 24 will be reappropriated to the 25 budget, resulting in a total available resources of $22,341,096 in 25 and 26 FTEs. That's an increase of 14 FTEs from the fiscal year 24 level. The carryover amount is projected to be less than the amount carried over in fiscal year 23. And the use of the carry amounts is reflected in the spending plan that's attached to your packet. The spending plan actually budgets a little bit over, well, actually not a little bit, but about $5 million over.
That's where I'm getting the 27 from.
Right,
Yeah, okay.
right. And we'll get to actually, I was going to walk us through the recommended adjustments, and then we can talk about
Sounds
kind of
good.
the overall. Okay, so the executive is recommending 3 adjustments, actually 4 adjustments to the NDA. First is a compensation adjustment, $60,884. That's going to be discussed in GO and by the full council. Then there's the 3% inflationary adjustments to nonprofit service provider contracts of $30,000. Again, that's going to be decided by the council as a whole when looking at nonprofits. There's a retirement adjustment of a negative $9,066. And finally, there's a shift of funding for personnel going from operating expense to personnel expense for 14 merit staff positions. And they are listed on page 7 of your packet. One is a program specialist to, as a business coach to support family child care providers. 10 program specialists and 1 program manager are staffing the Family Involvement Center program, which is projected to add 2 sites in fiscal year '24. There's a program specialist for the Infants and Toddlers Program Medical Outreach Coordinator to connect pediatricians and health clinics to raise awareness of the Infants and Toddlers Program. Council staff also knows there's an additional $10,000 that will be spent on early intervention screening outreach materials, and that DHHS is using a state-required pinwheel platform to share screening information among parents, pediatricians, therapists, and the Infants and Toddlers Program instead of the Chattis program, which the council had heard about in previous budget years. And finally, there's a program specialist for family child care recruitment specialists to expand and recruit family child care programs. Council staff does recommend concurring with the recommended merit staff additions. So for 25, there's a detailed spending plan that it's attached to your packet, but also council staff provided an annotated copy in front of the council members for this session. In the packet, it updates or provides an overview of some of the key initiatives and some of the main uses of funding in the initiative. So for sustainability, again, there's staffing that amounts to about $2.8 million to cover
Just before you do that, so let's dispose of this, the concurrence to the, no, I just want to make sure so we are folks okay with the concurring to these adjustments? Obviously, we're not agreeing to the whole thing yet, but these are adjustments. Which particular? So the one that, you want to restate that?
Sure, there's a shift
Merit
of
staff.
operating expense to personnel expense for 14 merit staff positions.
Yes,
Yeah.
correct. So without objection?
Yes.
All right, thank you.
Okay, so again, for the fiscal year 25 spending plan, for sustainability, there's 26 FTEs, including those 14 converted positions for $2.8 million. Educational scholarships at $500,000. The shared service business hub development at $300,000. The child care facility fund development and implementation for a total of $5,560,000. Training, professional development, business support to providers at $263,000. For access and affordability, for the child care subsidies, which includes WPA and state scholarship program, $4.5 million. The infant and toddler equity care grants that you heard about, $4.4 million. Preschool contracts, $840,000. Community portal development and staff is $2.5 million. And then the summer EBT county portion is $227,000. That's actually in conjunction with an amount that was included in the Children, Youth, and Families budget, Office of Eligibility and Support Services. For expansion, there's a proposed expansion of the basics program at $233,000, community-based Head Start to create 50 seats for 3-year-olds aging out of early Head Start at $680,000, and then you also heard about the $85,000 for coordination and collaboration between the ECEI and the coordinating entity. So those are what has been, outlined for the committee's consideration. But council staff did want to draw your attention to the spending plan that is at your desk. The concern that council member, there is this rollover that has happened, and most of it, I think, is because of the pandemic and availability of ARPA funds, as well as kind of things were thrown off in terms of being able to kind of expand the system during that time. At previous budget discussions, I think the committee had emphasized the need to spend out these funds, right? And that's important. So what you have in front of you is a plan, that really does, I think, is very thoughtful and impactful in terms of how it would go about, bettering the system. But the concern that council staff has, that is, the plan shows ongoing operating costs that exceed the annual NDA appropriation. It's by over $3 million. There's a couple of things that in the green that was handed out. A couple of them actually are one-time expenses, but I think it's safe to say that if all of these expenditures are made in fiscal year 25, it would require an additional at least over $3 million in fiscal year 26 to continue these efforts. So council staff recommends that the committee requests actually a multi-year restructuring plan for the NDA before council approves the fiscal year 25 budget. And the multi-year plan would allow work to continue at the NDA and to draw down funding over a longer period of time. And I think that would be, a sustainable approach to drawing down the fund balance.
Thank you, Ms. Yao. And the document you're referring to did not make it into the packet, but we will make sure to get it online for folks so that they can see it. It's a detailed spending plan that was sent to us by DHHS and the ECI. So, all right, and I think now we're ready to answer. We've teed it up pretty well. You've had a long time to hear it, probably. So, could you respond, Ms. Lambert, whoever's appropriate to respond to the concerns raised by both council staff and the question I was teeing up?
Well, if it is, number one, if it is the council's desire for restructuring, we can certainly work together to make that happen. Secondly, when talking about the capacity to do all of the things that are in the spending plan, we believe that the movement from brokers to merit staff will enable the initiative to do the things that are in the spending plan. We're going basically from 12 FTE up to 26. So we believe that with that additional support, that Jennifer and her team will be able to accomplish what is proposed as a spending plan.
Okay, so the additional capacity will increase the capacity to do the work, to spend the money down. And so the restructuring that the council staff's talking about would obviously then mean a lower appropriation this year. Or, so how would you restructure? What would that look like?
The goal is to spend down the total amount, the fund balance over a multiple year period.
So same appropriation, but that they put a plan to spend down the fund balance over multiple years, not as aggressively as proposed here.
Exactly.
Okay.
Exactly.
Another thought that went into the so-called overspending is that there are some components of the spending plan that are lumpy and may or may not happen. So, for example, we were thinking that the up-county quality childcare would be done actually in fiscal year 24. That's not happening in fiscal year 24. So part of the thinking when we developed the spending plan and over-programming was in the hopes that there are some things in the budget that are like that if we don't do them in fiscal year 25, we'll still significantly spend down and have much less reappropriation in fiscal year 25 into 26. So that was the thinking behind the spending plan.
And Council staff just wants to interject that the issue in terms of the structural deficit, or, you know, the structural issues with the spending plan are with the ongoing costs, not the one-time costs. So again, some of the thing that, the project that you just mentioned, the quality childcare in Gaithersburg, that is a one-time cost.
Right.
So there's not really a problem with, you know, that spending in 25.
Got it. Yeah, and a lot of this is for, you know, the FTEs, right? You know, you've got the 1.4 for the conversion, and then another 1.4 for the new FTEs here. Okay, so I think I will see where colleagues are. We'll go into the questions, but I think it makes sense to have that spend down restructured. From my perspective, I think that makes a lot of sense. The question then becomes, if you're spending that amount over multiple years, how does that relate to the appropriation? And that's why what you sent today is really helpful, trying to digest that, because you parse out those different items. Okay, so I'll pause there, and I'll come back and first go to my co-chair, Chair Alpenos.
Thanks. I'm going to ask a couple macro level questions. I'll start once again, as I try to do as often as I can, with the great news, which is that we're making progress. I really appreciated the joint presentation. The roles and responsibilities are becoming more clear as we're continuing to build this plane while we fly it. We've got some really smart, passionate, dedicated leaders who are here and in the community who are working day and night to follow our North Star, which is ensuring that every child in our community has access, and that means that it's affordable, that means that it's geographically close to people's homes, that means it meets people where they are, and that it's culturally sensitive, that they all have an option. That's the North Star. And how we get there is complicated. It's got a lot of layers. There's a lot of regulatory issues. There's a lot of policy issues. And, oh, by the way, there's a lot of funding issues, too. So get it. You know, we're never going to have our arms completely around this, but we can get and are getting closer to where we want to be. So I want to start from that place and expressing my deepest appreciation to all of you, because I can see the progress. I really honestly can. I guess my questions to start are more macro, to follow along with Councilmember Jawando. And to my colleagues in HHS and Mr. Hodge, I'm actually going to ask you to come up if you can, because I think you're probably in among the better positions to respond to this. But, you know, we are...
No, you're fine. There's one left.
There's one less.
So we are correctly and appropriately doing our best to grow the infrastructure of HHS to meet the myriad of needs that we have in a number of social service categories, and also respond to the needs of our community-based organizations and partners. But that has not been without contracting challenges, hiring challenges, and still trying to wrestle through the federal funding that has expired and us trying to absorb the overall funding. So I appreciate this plan. I know that we just recently got this information, and so we're still trying to process it. But at a macro level, Mr. Hodge, because I think you're in the best position to respond to this, I'd love to hear from the department's perspective, because these folks are doing the best they can with the resources that they are given. But this is sort of at a higher level. What confidence do you have that we will be able to implement this plan, because we can't do this in isolation? It's in addition to all of the other initiatives and strategies that HHS is trying to carry out. They're all important. They're all highly prioritized. But this one in particular, you heard from Ms. Yao that, you know, the funding needs to be out in the street yesterday. There's so much need right now. Can you talk a little bit about the department's overall strategy on how we're going to comply with this plan?
Sure, I'll do my best. Mark Hodge, I'm the Chief Operating Officer for HHS. So looking at, one of the benefits of having a non-departmental account is the fact that we can carry over, and the fact that some of our expenses have not come about as quickly as we wanted them to. Part of it was COVID kind of hit us. And then trying to catch up after that. I think we had a lot of really big ideas that took a lot longer for us to realize to be able to get that out the door as well. I think now having this spending plan, and I absolutely agree that we can restructure this to allow us to look at this over the next few years, so we're not starting off in a hole next year. But I'm very comfortable with the plan that everyone has set out. We've had lots of conversations with OMB to make sure that we are prepared for this. I think this is the year, FY25, that we will be getting out the funds that we hadn't been able to do in the past. And I think our readiness to do that, and the ability to hire staff to also, as Ms. Lambert said, having those staff will also allow us to get that money out the door as well. So from an infrastructure perspective, yes, there are some other inner workings behind the scenes that are not necessarily part of ECEI, but part of the greater HHS machine that is also prepared to make sure that this happens. So I'm comfortable, I'm confident that we can do this. And that we will make sure that any future spending plan that we provide, hopefully by next Monday, the 29th, in our follow-up session, that you'll feel equally comfortable with that.
I appreciate that. That's helpful. Makes me feel a little better, for sure. But, I think we're going to go through these line items. I know my colleagues are going to have lots of questions, but the great news is we have a number of tools at our disposal. And I do think, obviously, and I say this as a former executive branch department head, there are instances in which our partners are in a better position to be able to facilitate the work, not always, but sometimes. We have established a new entity. We have other providers. There are many examples. The Collaboration Council for Children, Youth, and Families is one of the bigger ones, where we have to acknowledge sometimes as a county where we're just spreading ourselves so thin. Everybody is so tired. Everybody is exhausted. And that is one of the reasons why we established the entity, in order to ensure that we have other options. So we'll throw that out there. I know we all know that, but I just wanted to sort of acknowledge that and how we facilitate some of these important resources. I yield back to you, Mr. Chair.
Thank you. And before I lose the thought, I'm going to turn to Councilmember Mink, Councilmember Lukey, and Councilmember Sales. Just the thing I said at the beginning of when we stopped on that slide about just having the overall picture of where we are vis-a-vis our need in our community. I just think we need to, that should be the slide every time. I would love for us to create that and drive towards that. If you're driving towards a goal, I think we just need to assess every time we come to talk about where we are, and there's obviously layers to that, and I think there are many goals, right? It's not just kids in programs; it's compensation for those employees at the programs. It's space. There's other things below it, but at the top level, I think we'd all agree it's our kids in those seats that are high quality, full time seats. So if we could just drive towards that, and even if we could have a preliminary for some of the questions I asked, for example, of that 40,000, what's the breakdown 0 to 5? When we come back next week, it would be nice to know that. And if you want to get extra credit, have a version of that slide, to show. I think it would be good. I'll turn first to Councilmember Mink.
Thank you. I appreciate the work that everyone here is doing. This is incredibly, incredibly important, and we need to make sure that we are funding the results that we want to see here. We need butts and seats. We need the expansion of access, and this really touches every goal, every broader goal that we have for this county, for our community. So appreciate the work that you all are doing. This is an important conversation that we're having today. And to Chair Jawando's point, having a better understanding of the numbers is critical. We really do need to be centering around getting those butts and seats. We're funneling a lot of money appropriately, absolutely appropriately into this space, but having an understanding of which of those line items are specifically adding how many seats will give us a better idea of where we should be putting more money and less money moving forward. So having those numbers attached to it is really, really critical. The community portal, what's the status of that project?
So this year, FY24 was for development and testing, and so it's been phased out in testing. The launch is expected for FY25 in July. It'll come out for the 3 touches of Working Parents Assistance Program, healthcare services, and rental assistance.
And so is there something that we can see to take a look at?
Yes, so the testing phase says we can send you the link so you can explore it and go in as a user and experience that. It is in different languages as well.
Great, yes, would absolutely love to see that. It sounds like a really useful tool. This is also a lot of money for a website, and I think that certainly a case can be made for the value, but I think it's important that we are able to understand and make that case, especially for that line item that we're looking at. For FY25, we're looking at just over $2 million for the portal to go live. Is that right?
Correct.
And can you explain why we needed about $3 million for the development and testing and another $2 million for the portal to go live?
So I'm actually going to defer that to get back to you because I'm not the developer of that. We contributed funds so that we could prioritize where it touches the lives of children, which is why we have contributed to that platform. It is sitting, Dr. Richard Nemhard is leading that initiative. I don't know if Dira can speak to it a little bit or if we want to defer and get back. So we can get back to you with that information.
Okay, please do. Yeah, that would be great. I know we're looking at website enhancements in various places in the county, and we have asked for a lot, a deep understanding of what that looks like and whether it can be done more efficiently. This seems like a very high dollar value, but I haven't gotten to see the website yet, and so I look forward to. Yeah, I would definitely like to get some more information on that and on what the ROI is for that additional. Just over $2 million as the portal goes live. The family involvement centers, wanted to understand those a little bit better because those are not child care seats per se, correct?
Correct, they are not.
Okay. And I understand that we are building an ecosystem here, but just wanted to understand how you've kind of done the cost-benefit analysis to think about, whether we're putting money into this as opposed to, say, increasing the working parent supplement or something like that, which has a direct connection to increasing those seats.
So a primary function or a primary value within the Early Care and Education Initiative, as well as in DHHS, is parent choice, where they choose to be spending time with their child or where they choose to have their child. So the Family Involvement Center is one of these programs that allows for parent or guardian, family member, to attend with their child in an activity. It is based on social emotional development, and so we use what's called the pyramid model to support engagement, and it's a parent education model as well, helping families engage with their children, as well as we've been able to connect it with our infant and toddler program for socialization of children who are not enrolled in any program, who are not engaged in group play. So again, it's really the stressor about having choice for parents. The initiative had launched this 2 sites. We expanded to 3 last year. The recommendation is to do 5. We've done internal evaluations. We are actually in the process right now of doing a Family Involvement Center evaluation of all of our programming and how to enhance them. There have been multiple recommendations on how to broaden our scope. We are very intentional about location. They're located in Up County, in Gaithersburg, in Rockville, and in Silver Spring. Our plan is to open 2 more, East County, and the 5th one to be decided probably up towards the Damascus area. So based on the evaluations we have from parents, internal surveys, having the opportunity where a parent or a grandparent can go and engage with their child can socialize with other, has been very beneficial. We have received really positive responses. I'd be happy to get back to you once our final evaluation is completed with more concrete recommendations on expansion and models to use and enhancements for our Family Involvement Center.
Got it. I'm raising the question because as we've looked at, for example, MCPS working on converting those part-time seats into full-time seats, these are no-time seats. And so, because the parent has to be with the child when they're there. So I don't question that people who have used the program have found value there. I don't doubt that the staff are fantastic, that there's a benefit there. But I think the question is, would the public, would our parents, would the community rather have us spend money to increase those seats versus full-time or even part-time seats, right? Like if we're looking at a spectrum of that, is that, if we know that they prefer full-time over part-time, wouldn't they prefer full-time over no time? Or is this serving a different sector of the population in a different way, and we need to make sure that that's available too? Now, my understanding was that kind of the project before us is we're all here working to expand childcare seats. And so if this is an additional component, then that's something that we should talk about. But I just want to make sure that we're not expanding a program that parents would prefer to be, again, money funneled into increasing full-time seats.
So it is targeting a specific population of families who, as I said, we've done strong collaborations with our infant toddler program for children who are receiving early intervention services and give them opportunities for socialization. So I think that's one segment. I think the other piece is, as we're engaging in the supply and demand study, to do a deeper dive into what parents need and want. It is, in terms of value-wise, choice is paramount. And while I respectfully, I hear what you're saying about where parents need, and I think one of the focuses of the ECI also is to provide, for example, the EquiCare grants for children who are in child care. We cover those tuitions. We have the Working Parents Assistance as well as the State Child Care Scholarship to help families who are working. We're also looking at expansion of Blueprint, making intentional efforts to have these preschool seats available to families. At this point, it's income eligible and it's free, with a sliding scale going further, as well as the pre-K contract that has childcare seats in the community, and that's expanding as well.
Right.
So we have a variety of things right now.
Right, I understand that, and I appreciate that, and I just want to, choice is paramount, but also we know that the choice between part-time and full-time is for them to all be full-time. So I'm gonna move on, but I look forward to circling back on better understanding the value there relative to, not in and of itself, I don't question the value in and of itself, but relative to, given that we have a finite amount of money to spend relative to other things. The CDFI, or the Child Care Facilities Fund, so we're looking at about just over $5.5 million of that. Do you have you're in the process of putting out the RFP, right? Or do we have a partner already there?
No, we're in the process of developing the RFP to release for FY25.
Okay. Is this, so I understand that the value here and that it comes with technical assistance and that this could be really useful to some of our providers, and I certainly appreciate that. I want to make sure that this is something that's brand new, and it's going to be brand new to the community, it's going to be brand new to providers. Do we have providers who are teed up to take advantage of this to the tune of, $5.5 million?
Yes. So the idea is for quality expansion or enhancement. And so through our research this year, our study was to discuss with providers. And so, yes, we do have programs who are readily excited for this to be released. The idea would be to have two different options, what is it called, 0% interest loan, right, and a grant, so that they could provide whatever option they choose for.
So the grant would be, it's not that the grant is not part of the $5.5 million, or is
that
it?
is, yeah. So there's two options.
Okay.
One is a how do I explain it? No interest loan, and the other forgivable loan. That's the terms. And so and that came straight out of the provider community. And as I said, there are multiple programs, and we are looking at prioritizing also where these loans would go in terms of underserved communities. And through our interviews, our focus groups, providers are very excited about this opportunity.
That's great. It would be great to, if we could get a list to find out where the geographic locations that you're looking at in the community of some of these interested providers, and how that funding breaks down. And I I feel like I'm asking for a lot, but also I don't, because this is $5.5 million, and I think it's important that we and that the public have a clear understanding of where that money is headed, and being assured that that money is going to get out the door, in this coming fiscal year. If we want, if there was a smaller amount that we were to put into this and then, come back for more, if it's flying out the doors, I think that would be great. But if you really think that's, if we're confident that this $5.5 million is going to go out the door and is going to turn into seats and all that, then I think that that's great. I think we need to have some really, really quality, transparency here on a line item like that.
I'd be happy to share the studies. We just finalized the studies, and so I'd be happy to share that with council.
And when you say studies,
it was the recommendations for what the RFP will look like. So we're writing up the RFP.
Okay,
right
so
now.
I'm sorry, no, not the RFP. I'm talking about who are the providers who are interested in taking advantage of $5.5 million through this fund.
Okay, so that included all the providers who participated in this work group and co-designing this. I can get their names.
Okay, great. Thank you. Thank you for the clarity. Last question, and then I'm going to turn it over to my colleague, is on the rest of the spending for FY24. So looking at the packet, is it correct to say that about $5.9 million has been spent in this fiscal year so far? That's the expenses row.
Expenses are $5.9 million.
Okay.
And encumbrances of $5.7 million.
Okay.
Fiscal 24.
For fiscal year 24. And then if we look at the encumbrances that are being projected to be spent out in FY 25, what we have left, I just added that up, so what we have left is about $3.8 million in encumbrances to be spent out for FY 24. And then it looks like, from my math, an additional $4.2 million that's left that would be projected spending, just non-encumbrances, just spending. So that comes out to about $8 million left in spending for the rest of this fiscal year. What is that, 9 or 10 weeks? I would like a better idea of, because how much has been spent so far in the fiscal year, again, is less than $6 million, and we're looking at a projected about $8 million in the next 10 weeks. It would be great to get some clarity on what that looks like, the rest of that projected spending for this fiscal year.
Yeah, we can get that for you.
Okay, that'd be helpful. I will yield.
Thank you, Councilmember Lukey.
Thank you. And continuing on that topic, specifically about the grants, the different grant funds that are available currently. And I don't know if this was just how it was phrased when you were speaking, or if it's really an issue, so I want to give you the opportunity. So we're 3/4 of the way through with both of those different grant funds, and you said, there was something to the effect of anticipate spending, but what I can't tell is how much went out already in those grants just in the 3/4 of the year, and why is the remaining quarter of the year on those grants not projected to be balanced with the other 3? Or is that part of why there's a gap in the questions like that Councilmember Mink was asking?
So I want to clarify, the grants that we have issued for this year are the EquiCare grants at $2.2 million.
Okay.
Those have just been released. Last night, the awardees received their notification. So now we're in the process of just finalizing those grant agreements to be able to release the funds for the $2.2 million grants of EquiCare.
Okay.
Other grants?
But they were funded to start for FY24.
They were funded for FY24.
Right, but they weren't issued till the 4th quarter.
Correct.
Okay. What blocks or other encumbrances are getting in the way of making sure that what's allocated for a fiscal year in terms of grant funding is reaching the intended grantees?
I think I'm a little confused with the question because there's only one grant that we have presented.
Right. But we're in the fourth quarter of the fiscal year, and my question is, why didn't it get out in Q1, Q2, or Q3? What happened? What was the impediment to getting that funding out? You know, if we're figuring out how to fund, our policy, as Councilmember Mink said, is to get buns in seats, right? We want people in these programs, and if the money that we appropriated for FY24, and respecting, of course, that the NDA fund is different than many others in that there is rollover, what was the hang up in getting it out the door until Q4, like last night before this hearing?
We started with the EquiCare grant, the process in the fall. It did not get over to Office of Grant Management until January, and so there's a process. Once it was released middle of January to the public application period, and then it closed in mid-February. And then from February to up until just a few weeks ago, it was through the process of reviewing all the documents, going back and forth with applicants to ensure that we had the right documents, giving them a chance to update, correct, submit correct documentation, reviewing those. It's a committee that reviewed. We had 22 applications, going through that process, and then going through the award. That took from mid-February until just a few weeks ago. And so now we've released. So it's a procedural piece, I think, in terms of working with Office of Grant Management. I do want to stress that the Office of Grant Management has been extremely helpful in this process, but it is a small team.
Right, and then my next question is, how does that, understanding now what the life cycle was for the one grant stream, and then you would be now requesting for 2 different grant type streams, or multiple streams, we'll just put it at that. What, if anything, might you have learned from this process that would affect or could demonstrate that you might need to prorate the feasibility of the funding?
So with the CDFI, the Facility Expansion Funds, that is going to be RFP to a Community Development Financial Institute, who will lead that initiative and be able to release the funds based on their own application process and technical assistance.
Right. So once the RFP goes out, how long will the RFP be live before someone's selected to do it, before it's up and running? It would be helpful for us to have that kind of a timeline, which helps us to better understand the fiscal projections.
I expect that the RFP between release and finalization will take anywhere about 5 to 6 months.
Okay.
So by the end of this calendar year, we'll be able to announce our CDF, or the Community Development Financial Institute.
Okay. And then for the, obviously, appreciating the comments about full day versus half day, and, you know, I was always in one of those please full day buckets, right? I think that's where most people are who are in need of childcare. Do you prioritize for filling those seats, those where they either only have a single parent or a single grandparent or what have you who is working, who is not available, where childcare is, or lack thereof, is an impediment to their ability to work and provide for their family? Or is there no discernment between?
For child care or for pre-K within the public school system?
The child care for the...
So there is no discernible difference for that.
Okay.
The current subsidy, the current model, right, child care, they're private businesses, right?
Right.
And so if there's any assistance for subsidy, those are based on income eligibility. And both parents, if they're both caring for the child, have to be working.
Right.
So that's what the requirement is.
Gotcha.
There's no other consideration.
Okay. And then, sorry, I have a lot of notes. And thank you for the coordination, for the technical assistance that does need to be coordinated, and for putting that in there. This is a huge issue. We've heard it out in the community over and over and over again. And thank you for explaining Montgomery College's efforts in the language education realm, because that is a critical piece of this. It's good to have bilingual early childhood educators, but we also need to make sure that for the kindergarten readiness and the blueprint standards, it has to be done in English, which is, can be a challenge. But that's what the expectation is once they're transitioning into kindergarten. In terms of the study that's listed on here, and I can't count how many numbers, 1, 2, 3, 4, 5, I don't know, kind of a third of the way down the page on the front side of what we were given today. is a workforce and compensation study, and there was, on one of the slides, you had the RFP, that it would go for an RFP. And, I note that there is some data already about that that's publicly available, and what I did while you guys were talking was pull up the data from fiscal year 2017 to fiscal year 2022 to see, just for Montgomery College in the ECE and language program, the numbers of distinct either degree or certificate program recipients, and then the percentage that were found in the workforce based on wages, Department of Labor data within 1 year of finishing their program. And it was interesting because in 2017, 74% were visible in the wage data within a year. 2018, 87. 2019, it dipped to 69, because you would expect if they completed in 2019 and then the pandemic hit, things got weird. 2020, it was 54, not unexpected given the pandemic. And then it went back up to 72% in 2021, and in fiscal year 2022, 96%. Which is great. But I'm raising this because within 5 minutes, I was able to pull up that information for myself, and I wanted to know what you anticipate spending $250,000 on a study for when some of this is already publicly available.
I can answer that. So the workforce compensation study is looking at a deep dive into our workforce. We're looking at what, if any, degrees they have, what educational background. We want to understand the demographics. We want to understand ages. We want to understand their compensation. What is it that is contributing to benefits, what their salaries are. So there are pieces of information that are out there, but ours is very centric into Montgomery County and our current workforce, and finding out what is happening with our education and practitioners. This is also informative in terms of how our child care programs are structuring their salary scales and benefits, and being able to leverage also what the true cost of operating a child care program is. The study will complement our cost of care study that we're doing as well. Operating a child care program, having done so myself, anecdotally, I can share the math doesn't work.
Right.
And so our goal is to be able to understand what are the true intricacies of within the child care system, and try to leverage policies that will help with our compensation situation with our early care and education practitioners.
Okay, thank you.
Thank you. Council, I want to ask something about the studies, but I'm going to go to Council Member Sales first, and I'll come back to that.
All right, thank you to my chairs for coordinating this meeting, and for everyone here coordinating the efforts to meet the early care and education needs of our students. I think we can all agree that that's what we're here for, to ensure that our most important resource, our children, have the resources and foundation they need to succeed. I know that we've been working on this for quite some time. I looked back at the 2017 Office of Legislative Oversight study that was conducted. It looked at the cost and benefits of expanding pre-K in Montgomery County. It yielded 4 recommendations. Those recommendations 7 years ago were in the 6 figures, millions, the 9, almost quadrupled what we're spending annually to coordinate those efforts. But 7 years, we had recommendations, and we are still trying to coordinate the efforts to provide early childhood education for our neediest residents. And so I think most of the questions have been asked. I'm just trying to understand a few of the numbers in the chart. I'll first ask about the EquiCare grant. That grant is serving additional students for 2024. How many additional students are we able to serve with that EquiCare
So
grant?
for this year, it's 75. For FY25, the 150.
Okay, okay. And so how are we accounting for those students? Are they already enrolled, or is that for the summer? Because the new fiscal year will end June 30th, so.
So there are actually seats, so which
Yes.
equates to a child, right? And the idea is that as the children, these children are not enrolled, and they're typically in families who cannot access quality childcare because they can't access subsidy. So that's really our target.
Okay.
So at this point, once we just released for FY24,
Yeah.
they'll be filling those seats. It is a grant, and each program has submitted a scope of how they will be doing the recruitment and filling those seats.
So you prepay, and then we'll get the students in before the end of summer?
Correct.
75 students?
Yes, yeah.
But what
the first-
sort of curriculum or enrichment are they going to get
So
for
each,
less than 2 months?
For less than 2 months?
For
So
FY24?
So this is ongoing, so it rolls over into FY25, so the 75 that are accepted now will continue for another fiscal year, and it's actually a 3-year renewal,
Okay.
and then we'll be adding to that as well. They are licensed childcare programs who follow state curriculums. They have to be Excels level 3, 4, or 5. They must be accredited, and the staff have to have a minimum of an AA degree for the lead teacher and a CDA with experience for the assistant teacher.
So does that include the hiring of new staff, or are you already contracted with the facilities that will absorb the 75 students?
The programs will already have the staff. They submitted a contract already meeting those requirements, so they can start right away.
Okay. Yeah, if you can keep us updated on
Absolutely.
when those seats are filled. And so the SNAP benefit, I see that you're serving the same amount of students for, well, no, almost quadruple the amount of students for the same amount of resources. How much are we receiving in grants to meet that need?
My understanding is that the reason for the increase in students served is that the state is leveraging federal funds.
Yes.
That
How much?
allows for the same amount of money that we're providing to the program to serve more children in fiscal 25 than fiscal 24.
Yes. So do we know how much money that is, and how did we calculate that amount?
So it's about 227,000.
Yeah, that's what
That is
we're-
in the
budget.
non-department account, another 211,000 in HHS general fund, and then the state provides some funding, roughly the same amount of funding as the county is funding, and then the state leverages the federal funds that allow for the increase in the number of students served.
Okay. And how are we identifying those students in MCPS? Are they already enrolled in SNAP, or how is this?
I'd have to get back to you on that answer, but I would suspect they're already enrolled in SNAP, and this is continuation of services.
I'm just wondering how they're identifying the additional students. So yes, if you can find out about that one. And then this entire, I believe it's,
Councilmember Sales?
Yes.
We're joined by Dr. Mensah, our social services officer. He could provide a little bit more clarity on how the state identifies, how those children are identified.
oh, good, thank you.
All right, Oscar Mensah, Social
Bring the
Services.
mic towards you, please, Oscar. Thank you.
Oscar Mensah, Social Services Officer for Montgomery County. For the kids that are going to be in SNAP, they are already participating in SNAP. So we are using the same data in order to be able to kind of serve those families.
Okay.
Yeah.
Okay.
Yes, it's a continuation of what we did last year.
Oh, okay, okay. Because it just looked like more students were being served, so.
Yes, we are going to serve larger number this year due to the state funding. We're serving 70,000 or so
Yeah.
in Montgomery County. Yeah.
Okay. All right. And we're spending almost 23 million for FY25, or is that just the amount that's going to be carried over on this new sheet that Ms. Yao brought over. I see the budget is 11 million. We're carrying over 11 million. So the fund balance is going down to 5 million this year.
Yes, with the funding that will be provided to the CIP project for the facility fund. So that should take 5 million from the 11,080,752.
Okay. Okay, I yield. Thank you.
Thank you very much. So you had a lot of questions and some things we need to follow up on. We've agreed on the restructuring plan that you'll work on. There's some other questions that colleagues asked, follow up for. I asked for a few things myself. So I think what we're going to do is we're not going to approve the budget today. We're going to schedule another meeting, hopefully for Monday afternoon. There's an HHS meeting that we're going to try to, that probably will go pretty quickly. I was talking to my co-chair, and we will try to add on another joint meeting that afternoon to come back, and hopefully that'll give you all a few days to come back to us with some answers to the questions, and we'll work with Ms. Yao to make sure you understand the questions and that there's no ambiguity there, so that we can round it out on Monday. Okay? Thank you all. Really appreciate it. So we're going to move to the next item.
We're still going through early care and education, though. So, the budget for child care subsidies in
yes, the
youth
next
and
item
families-
within early care and
Yeah,
education, which is the subsidies. Sorry.
Yeah.
Yes.
The executive recommends $1,969,414, an increase of $35,703 over the fiscal year 24 level. There's no change to the number of FTEs. The table on page 8 of your packet shows the total amount budgeted for the Working Parents Assistance and state child care scholarship programs in 24 and recommended 25. So for WPA, that there's a total of $3,414,000 from the general fund, and then the NDA non-departmental account, there's $4.5 million. Anyway, so the total amount budgeted in 25 is $8.5 million for those two programs, but they're coming from different sources. And the table on top of page 9 of the packet shows utilization of the program in 23 and 24. So council staff recommends concurring with the executive's funding for the child care subsidy program that's programmed as a children, youth, and family services program. It's not what's programmed in the NDA.
Thank you. Any comments on that? Okay, without objection. Ms. Yao, I'm sorry, before you move on, I remembered the studies. I wanted to ask about the studies. So we've been hearing about these studies for a long time, and I know they've been progress made, and I just want to allow you spoke kind of to some of them, but for particularly because they're in this budget as well, and some of them are previously encumbered, like the cost of care you talked about, supply and demand, I don't think we've said much about yet. So could you just give an update on that and where that is?
So supply and demand has started. We are in phase 1 right now, 3 phases. So we have a timeline. It started in February and it will end in September with the release of the study. Right now we are...
September, we'll have the findings.
Yeah.
Okay.
Yeah. We have escalated because of the delays. We really wanted to make sure that we get this work out sooner versus later. So we've worked with our vendor. At this point, supply and demand has, as I said, started phase 1, in which we are doing focus groups and interviews and surveys with our child care community. One hiccup, if we can call it, was that the state is also doing a cost modeling supply and demand study as well. That was released very quickly. We were unaware of that. However, we've worked with the state to be able to really align what our efforts are and what their efforts are so that we don't, over-survey the community, but also be able to share results so that we can get a really good picture of what's happening. Ours is very Montgomery County centric, and finding out, as it stands, Montgomery County, I think, is the most challenging within the state in terms of the quantity. We have the most licensed childcare programs where they're located, deserts in Montgomery County, and then finding out what the parents' needs are. It's very transient going into DC, and so we really want to get a good picture of that. And so the state has asked that we share some information with them, and they're going to share information with us. So we're working our two vendors together so that we can maximize those results. So the surveys and focus groups and interviews will go out now. Over the summer, they'll be quantifying everything and writing their recommendations and findings, and in the fall, we'll release those. In addition, we are planning, as with our other studies, to do community town halls to present these findings so that everyone benefits from it.
So we can expect that to happen this fall?
Correct.
Okay, because that's one, we're eager to, and I think we're all eager on that one.
Yes, we are.
It's a very important part of the pie where I started about what the need is. And then the other two, so will the other two be done in 25, or in this fiscal year as well?
All right,
will they be completed?
Let me go through them. So supply and demand, I just talked about. Cost of quality will also be completed in the fall.
Okay.
Then we have the CDFI has been completed in the and the shared services have been clear. We're going to release those. And then the compensation and workforce study for that will be released at the end of this year. So more like November, December.
End of this year.
24, sorry.
End of the calendar year.
Calendar year.
So all of the studies will be done by the end of
Yes.
this calendar year?
Yes.
Okay.
Yes.
Good. You heard that. And then, so we'll come back and we can talk about them all
Absolutely.
together and in concert. Okay, that's good news. Councilman Rick, you okay? Okay, great. We can move on.
Okay, so the next program is Early Childhood Services. The executive is recommending $13,488,408 and 46.33 FTEs. It's an increase of $694,000 or 5.4%, and a reduction of 0.5 FTEs from the 24 budget. The only recommended change by the executive for the program is in multi-program adjustments. Council staff notes that the functions of ECS it performs as a part of the ECEI, but it also it's only a part of the work of the program, and it has other initiatives and other programs like child care quality enhancement, recruitment, sustainability of child care, et cetera, to form a comprehensive portfolio of supports for young children and their families. Included in early childhood services is the infants and toddlers program. The table on page 9 going to page 10 shows the recommended funding amounts for fiscal year 24 and then recommended fiscal year 25. It's an increase of $338,000 from that the executive is recommending for 25. And there are some service data that's included on the table on page 10 of your packet, which shows an increasing trend in services to the program. In addition, in early childhood services, they fund community-based pre-K. That's actually been going on for a number of years. It's a full-day program. For fiscal year 25, the executive is recommending $2.1 million for 150 seats. It's an increase of about $840,000, which will support additional children. Sorry, hold on a sec. Oh, yeah. So part of that increase actually is through the NDA. The budget in early childhood services was $1.268 million, and there's proposed an increase of $36,955 in the early ECS budget, which amounts to the 3% inflationary adjustment. So council staff recommends concurring with the executive's proposals for early childhood services.
Without objection. More buns and seats.
Part of NDA, right?
No, for the funding that's in the program Early Childhood Services, which is
not
the
a part
children's-
of, not the NDA.
Not the NDA.
Not the NDA. Yeah, sure. So we're withdrawing without objection for now.
Or it's just on pause, that's all.
On pause.
But I just wanted to ask a question since it was in this table. So there's operating expenses attributable to Medicaid revenue, and then also salaries expenses attributable to Medicaid revenue, but it doesn't tell us anywhere in here what we get, like obviously you need to do the work in order to process it to get revenue back from the Medicaid program. Is that why this is here and listed as an expense both in operating and salaries? Oh, we have another contestant coming up to the front.
We play a game. How many people can we get to come down from the back?
All in the end chair, yeah.
Jason Rundell, Budget Manager, HHS. So it's a unique grant where we're allowed to reappropriate revenues that come into the grant itself. So that's what that number is recognizing. So the revenues from the services sort of go back into the grant and then are budgeted and spent. So that's the estimated amount that we're allowed to
that
project
you will be
for.
getting from Medicaid back to go into the program. Okay, that would have been a good thing to explain, but okay. Sorry I bothered everybody. Pause lifted.
Thank you very much. So, without objection.
The next item is Children's Opportunity Alliance.
Yay.
The table on page 10 of your package shows the fiscal year 24 and proposed fiscal year 25 budgets through the NDA, the Children's Opportunity Fund, NDA, and MCPS. The total amount recommended for 25 is $1.196 million. The executive is recommending $1,071,879 for the NDA. The organization's 24 and estimated 25 budget is attached at circles 39 and 40 of your packet. The increase that the executive is recommending includes a 3% inflationary adjustment to nonprofit service contracts of $24,492. And there are, 6 additional increases recommended by the executive, both in the original fiscal year 25 operating budget and then additional ones in the amendment, and they're broken out. So the first one is development of a data dashboard for $45,000. The one-time funding would support development of a tool that would make this early care and education system data readily accessible. It could be used to report on efforts to improve the system and measure progress in serving young children and their families. Development of advocacy and outreach materials for $42,500. This is one-time funding that would develop advocacy and outreach campaign materials to raise awareness in the community. Board and staff training and support, $79,700. This would be one-time funding as well, used to support the Alliance as a new organization with board and staff training. Community engagement coordinator for $63,000. This would allow COA to hire a coordinator, and presumably this would be an ongoing position. Contractor conducted research projects for $25,000. It's a one-time amount that would allow COA to contract for research around best practices. And then the last thing is piloting blueprint application support and management for $55,000. So, Council staff recommends adding each of these amounts to the new and enhanced program list, and then set a priority order for those amounts.
Appreciate that. Ms. Resnick, do you have a suggestion of priority order based on that recommendation? Because that's likely what we're going to need to do, but I want to allow you to talk about your budget overall, if you have anything to add, but then specifically about these items.
Sure. So I don't necessarily have anything to talk about the budget overall.
Great.
I think
Skip that part then.
we're in good shape.
You're happy with the submission.
Things are moving forward. I think in terms of prioritizing the asks, I would probably put, I'm just looking at them, I would put the community outreach and research first, data dashboard next, then outreach, blueprint, equity coach, and board and staff training. That's how I would list them in terms of priority.
Okay, and if we can, you have
Yep.
that. You have that information.
Yep.
Great. And then, go ahead. Go
Well,
ahead.
so can you help me understand exactly what that means? So if I say those are the priorities and that's how it's going on the reconciliation list, then that's
New
what
and
we'll
enhanced
get.
programs list this year, but same thing.
Okay, programs list, whatever it's called.
Yeah,
Okay,
yeah, the list.
okay, the list.
And then it would, they would be listed as line items.
Okay.
And then council members, based on affordability.
Is there an opportunity if I go back and confer with my team that they
Absolutely.
say I should move number 2 to
Yeah.
number 1, that I
And
can do that?
I didn't actually expect you to like turn it
Okay.
around on a dime just now, but that was impressive.
I try.
But since we're coming back Monday, just if you could put it on paper,
Okay.
that would be helpful. Talk to your board, talk to your team.
Okay.
And again, and that would be good. And if you want to tier them, sometimes when things happen, you bunch a couple in tiers. We're open to whatever
Okay.
you think you want to do, and then we can decide on how to put them together.
Okay.
On the blueprint, council staff raised to the point about, is it this type of direct support to child care providers more appropriately performed by the Child Care Resource and Referral Center? Can you speak to that?
So,
On the blueprint application and support line item.
right, so that is what Nichelle talked about in her talking points, as well as me, what we are doing right now to provide support to the 5 child care centers who are right now working on their grant application and looking to submit them at the end of this month. We're actually using private philanthropy to get
Okay.
that started this year. And so those applications will be submitted either this week or next, and then decisions will be made in June. And I think what we continue to think about too is with that hub model, some centers wanted the grant writing only. Some wanted grant writing and the back office administrative support. I think it'll be interesting to see as that moves forward. The hub model was part of what is in Bill 1441 and putting that forward. Moving forward, hopefully there will be funding from the state, and I think we are in continued conversations with HHS and ECEI about whether it is best for that hub model to continue to stay with us or to transition to HHS.
Okay, so for this
So
year.
we were doing it for expediency to get it up and running, but we'll continue that conversation moving forward.
Perfect, great answer. Turn first to Councilmember Sales.
Thank you. I didn't catch the full order, so I'm glad we're going to revisit that on Monday. I did have a question about the outreach materials, the advocacy materials. Now, is this just to raise awareness about COA's role, or are these to recruit students, new centers?
It is connected to our legislative mandate, which is to raise awareness about the importance of early care and education. So it will be general, but it will also be specific to some extent to Blueprint. Part of what, as we have gotten out into community and talked with parents and nonprofits and other community stakeholders, they ask questions like, will my child qualify this year? Is 2-tier starting this year or next? How do I figure out whether or not I qualify? And so I think part of that information and materials will be some flyers and other information, some pages on our website that we're hoping that families can easily go to and say, okay, I'm a family that has this many people in it, this is my income, do I qualify? And if I do, where do I go? And where are the seats that are available in this next school year?
Good. No, that's helpful. And then the community engagement coordinator, will that increase partnerships?
So we are hoping to have, if approved, to have that community engagement coordinator on as soon as the summer, potentially. Because part of what we realize is there are more partnerships and relationships we need to build. We did bring on our early care and education manager, and she is building partnerships and relationships with the child care associations and child care providers. We are doing our best to connect with parents and nonprofits, and we rely heavily on the members of our board who represent those communities, but realize that as our community is large and diverse, and as staff, we have one staff member who speaks Spanish, I speak French. We know that we need more outreach to be able to spread the word and to find, hopefully, additional staff who speak other languages, who will continue to build partnerships with parents and providers and other stakeholders.
Well, I know that we estimated about 75,000 under
0 to 5.
0 to 5. And so I'm wondering how we're already communicating with those entities, or how we will communicate with them to find out how the, is it 3 and 4-year-old classes are?
So I believe, if I'm speaking correctly, and my team can correct me, but so what we presented is currently we believe that there are about 30% of children ages 3 and 4 who are engaged in publicly subsidized seats in Montgomery County.
Okay.
So those could be pre-K seats at MCPS, they could be working parents assistants who are 3 and 4-year-olds, it could be state scholarship seats that are funded, and so that is only children 300% below the federal poverty line. So that's who's currently being served, we believe, from doing our data analysis. So the hope is to continue to increase those numbers moving forward.
Yeah, it would just be good to be able to coordinate efforts across those entities.
Yes.
And if this community engagement coordinator, before they start growing, if we can tap into what's already existing and get a better understanding of how we're utilizing those. Okay, thank you.
Thank you. And I also want to note that most of your items, I think all but the coordinator, are one-time expenses, right? It looks
ongoing.
Well, the coordinator's ongoing, but I think the others are all
The
one-time.
coordinator is ongoing,
And then maybe
and
the
the
blueprint.
research is ongoing. But I think the data dashboard, the outreach, the blueprints, the equity coach, and other
One-time.
staff training is one-time expenses.
Just something to think about when you prioritize your list, because we look at one-time funding different than we look at ongoing funding.
Okay.
And so just to think about that, with one-time funding sometimes being easier, but not always. But obviously you have to prioritize it based on what you need to. Councilmember Mick.
Thanks. Yeah, I'm glad we're coming back to this because, as we've been talking about from the beginning, we're looking at this holistically. We have, multiple partners who are working in this space of trying to expand early childhood education. And so I think it's important that we look at it from a fiscal perspective, that we look at it that way as well. So we have projects and efforts by multiple different entities here, and we have money to spend across these different projects. And so I think that we need to make sure that we're having kind of one large conversation. Like, the public doesn't care, like who's doing what. They just want those seats expanded. And so I just want to make sure that all of these line items should get the same, for across entities, should get the same level of scrutiny. And we can also be doing thought about, like, are there ways in which some of these line items should be integrated, and how does that, affect the budgetary, layout of this field? Like, as we look at, the advocacy and outreach, COA, from what I understand, is, that's kind of your role here. There is advocacy and outreach that's being done in other sectors here as well. Should those be brought together in some way, or are those already being brought together in some way? I see that there is a budget line for coordination and collaboration between ECEI and EC coordinating entity. Like, what is that, and is that something that's being accounted for in other agencies as well? So I appreciate that we're coming back to this. I think it's, again, important that we look at this holistically, that all of these line items get the same level of scrutiny, and I want to make sure that we're not like nickel and diming stuff that's in the 10,000s here because of the kind of like logistical setup of how we're doing the budget, and that we are really thinking about what exactly we need to be funding and how, as a big picture, and that when we bring this to the full council, that they also understand that whole picture, and as they consider the funding decisions that are going to be before us.
I appreciate that point. Okay, so you're going to come back with the list. I'm really happy that the data sharing has moved forward. I noticed that you said that earlier, and that data will be coming soon, and that will help you. And happy to see that coordination. I feel better this year than I did last year, and hopefully you all do as well. And a lot of, I think there's progress been made. So thank you. That's really good to hear. So without objection, we don't have to approve anything because you're going to come back with your priorities. So, but the overall budget, you presented it. Anything else, Ms. Yao, on Children's Opportunity Alliance?
No, I mean, if you want to recommend approval, just with their
Yeah, I think what
priority,
we're
we
going to
can-
do is we're
we
going
can
to
do
put
that.
them on the list based on
Yeah, they're,
what their priority is. So I
Yeah.
think we can say we're going to approve it, but it's just going to be your prioritization of the items, right? That's my understanding. Because they would all have to be added to the enhanced list. Yeah, for what you, yeah.
Just want to clarify, is Children's Opportunity Alliance also coming back for the Monday session? Because I want to
I
make
would
sure
hope
that.
so.
Okay.
Yeah,
So,
if you can.
okay, so I just want to leave like the budgetary conversation as a package open in case there's, I mean, like, the data dashboard, should that be living within the portal? You know, the advocacy and outreach, should we just be staffing up COA to be doing, you know, more of that? Are there just ways in which, you know, now that there's kind of a clearer division of labor, you know, are there ways in which we should be kind of like finagling this? And you know, if you all want to come back with thoughts about that, that'd be great. But I just want to leave that flexibility.
I'm happy to, we can approve it on Mondays. That's not going to have it, so we can hold. Yeah.
Okay.
So we'll come back to it. You'll get us the priorities list. We'll come back with the additional information from ECEI. Did I get the acronym right? Yeah, I did. Okay. I said it fast. All right, Ms. Yao, I think Head Start, right?
Yeah. So for fiscal year 25, the executive is recommending $4,754,762, 2.8 FTEs for the Head Start program. It's a decrease of $141,299 and level FTEs from the fiscal year 24 level. The decrease is in multi-program adjustments, though council staff understands that our federal partners have not yet provided a cost of living adjustment or potential funding for quality improvements, so that funding may increase in fiscal year 25. The number of seats anticipated is to remain level at 648 seats. That includes 571 full-day seats and 77 part-day seats. The table on page 13 of your packet shows the enrollment numbers for full-day and part-day in fiscal year 24. Just as a question, council staff know, you might be interested in understanding what factors account for the vacancies in the four-year-old program, and council staff recommends concurring with the executive's recommendation for Head Start.
Sure. Did anyone want to speak? Do you want to speak to that, the vacancy, and then I'll turn to Councilmember Sales.
So vacancies in our Head Start program are very low. However, our pre-K program definitely has some vacancies in four-year-olds, and those are primarily in part-day seats, which I explained earlier in the presentation.
Earlier.
Right. So the more seats that we convert to full day, we believe that we will be able to fill those seats.
Okay. Councilmember Sales.
Yes, just had a quick question about the four-year-old class for the full day. Do we have any children on the wait list?
We have space in our programs. However, there are families, let me go back. There are classes that are filled in certain areas. So while we have space, it may not be geographically close to a family member or a family, and they may choose to decline until there is space closer to them.
Okay. So do we have any students on the wait list?
So we do have students who are waiting for space closer to their program, yes.
Okay, and how many students do we have on the wait list currently?
I'll have to get that from my staff.
Okay,
Yeah.
thank you.
Okay. Any comments from the colleagues? So without objection, approve Head Start.
Okay, we've heard an update on the MCPS program already, so we can skip that. There is an update on the blueprint for Maryland's future. The Department of Health and Human Services, in collaboration with MCPS and COA, provided an update on their blueprint pre-K efforts. So that summary is on page 14 of your packet, and the Joint Committee, again, may be interested in scheduling a follow-up discussion on this instead of taking the time now to go through it.
Well, we have a lot to follow up on. We're going to come back in the summer and then into the fall and the reports, on all the, definitely want to have that session as the studies come in, and I'm sure we'll find something to come back and talk about in the summer. Maybe we can add this to that. So
Okay.
appreciate that. Let's move on for now.
Okay.
I think that's it, right?
That's it for early care and
Okay,
education.
until Monday afternoon, right? So thank you all very much, and we'll see you next week. And now we can move to school-based mental health services, school health and mental health services.
If you need to walk away, within your,
Oh, we can get through all of this.
Seat is warm, so. All right. Ms. Yao, do you want to tee us up?
Yep. The first program in this area is School Health Services. This program provides mandated health services to students in Montgomery County Public Schools. For fiscal year 25, the executive is recommending $45,734,853 and 352.11 FTEs. It's an increase of about 7.3 million and 18.74 FTEs from the fiscal year 24 level. The executive is recommending several adjustments in this area. The first one is the annualization of dedicated school health room staffing for new community schools added in fiscal year 24. That amount is $1,271,024, and it continues, I guess, the staffing that has been started in 24, and council staff recommends approval.
Anything to add, Mr. Hodge, on any of that? You don't have to, but.
Just a discussion about a quick comment, actually, about the community schools. So we expect that there'll be another group of schools that will be introduced by the state for Montgomery County. Our best guess was 7. For FY25, it may end up being more, although I'm hearing that that community schools are going to include middle schools and high schools for next year, which we already have staffing for. So for the 7 that we have, that was our best guess. We're still waiting on the list from MSD to finalize the community schools for next year.
So you think 7 new ones?
So 7 new ones that we were guessing. So we may have to come back later in the year to ask for a couple more if we end up with more community schools than we were assuming.
Got it. Well, I love community schools. I think we all do. And
yep.
So.
And a good news item, we only have 4 nurse vacancies in school health at the moment.
I was going to ask about that.
And we have 2 vacancies for the school health room techs, but we have 17 individuals going through orientation right now. So those will be filled. So
2 vacancies of?
2 vacancies of the school health room techs.
Techs, and only 4 nurses?
4 nurse vacancies.
And that's out of a total number of?
142 nurses, I think that's right, and 212 techs.
That's good. That's much better than in the past.
Yes. We just sent selection memo for 4 people. So
great.
Yeah, very
great.
good.
What were you going to say, Ms. Yao?
I was just going to say the item that Mr. Hodge was referencing it skips down one, but it's the enhanced state mandated dedicated nurses for new community schools, and that's $908,318. And before that was adding the Maryland Department of Health grant for school-based health centers, which funds somatic health service contracts for high school wellness, as well as the school-based health centers at elementary schools for $1,144,482. There's a cost increase recommended in existing school-based health center contracts of $384,915, and that's to cover cost increases to existing contracts. And there's multi-program adjustments of $3,581,596. So all of those, council staff recommends approval.
Any comments? Okay, Councilmember Sales.
Yes, just had a question about the new state mandated nurses for the community schools. I see almost $1 million allocated for that. Given our difficulty with recruiting nurses, how quickly do we think we can get those positions filled?
So once we have the positions created, the new positions created, it's taking about 6 to 8 months to fill them. We are down to 4 vacant positions now. We generally have a good recruitment period for the beginning of the school year, and so with the 4 vacancies now, we're likely to have a few people who retire, resign over the summer. And then the 7 new positions, I'm sure at the beginning of the school year, we'll be back up to over 10. But we've been able to fill those to date with our temporary nurse contractor. So none of our assignments are vacant, but our positions are vacant. But we're able to currently fill them with Maxim, or their new name, Emeritus Health Systems.
So are we getting rid of the contractor positions once we fill the 4?
Yeah, so they're only the contractors are only backfilling at this point, yeah.
Okay, we're not transferring,
we're not
transitioning, okay.
We have, it's been a good recruitment strategy for us. Some of our temporary nurses have been applying for our nurse jobs. So I think once they see school health and are involved in it, they are able to apply. So yeah, that has actually been a good pipeline for us.
Very good. Good to hear. Thank you.
And Mr. Hodge is always available if we need someone to swap in at the schools, right? As your former.
Indeed, yeah. As a former school nurse, absolutely.
Councilmember Mink.
Just noting, there's still the plan to do bridges, to do less of an expansion of the wellness centers than had been previously discussed, as we've discussed at previous sessions, because of the insurance issue not saturating the market, because of just we're not sure about the cost benefit analysis. Is this right? That I just want to note that because I think that we still need to circle back on the specifics for that.
Right, for the CIP for FY25, that is correct.
But that implies,
but we haven't finalized it.
But that implies some operating costs as well, like there's staffing decisions that go along with.
In future years, yeah, because those don't exist currently that are in the CIP. But yes, in the future that could
So I look forward to circling back on that. Thank you.
Thank you. Okay, so I think without objection, we approve those.
The executive is recommending $14,804,154 for linkages to learning and school-based health centers in fiscal year 25. It's 9 FTEs. An increase of about 500,000 and a level number of FTEs from the fiscal year 24 approved level. There are several adjustments recommended for linkages. There's 150,000 to enhance linkages to learning bilingual therapist contractor salaries to improve recruitment and retention. And the committee has heard all about difficulty in retaining and recruiting mental health therapists. At the nonprofit level, it's, I think, even more challenging because of benefit and compensation issues that nonprofits may experience. So there is a great need for this. Council staff recommends approving this adjustment and adding it to the new enhanced programs list.
Ms. Martin, come on down. You're not going to get out that easy. And Dr. Kapunen, I don't know if there's anything you want to, but you're okay, good. You're fine where you are. We like to see if we can get everyone down. Ms. Martin, could you just add to this request and underscore the need and anything you wanted to add? And good to see you.
Absolutely. Good to see you. For the record, Monica Martin, Administrator for Child and Adolescent School and Community-Based Services. This comes straight out of our Linkages to Learning Strategic Plan that's been in effect for FY23 through FY25. So we're happy to see this in our county executive's recommendation. This is based on provider input. It is obviously linked to what you already heard is the high demand and low supply of licensed therapists available. Our nonprofit community, is exceedingly skilled at bringing multilingual professionals into our schools, and the number one barrier they cite in recruiting and retaining multilingual folks at schools is salary. So they do have a differential in place already. We need to bolster that to sustain our recruitment and retention efforts. We're doing well with not having a lot of vacancies, but we don't have as many multilingual therapists as we need to have per our school communities and our providers' priorities. We also, speaking of pipelines, Linkages Learning often serves as a great pipeline for therapist positions within county government. We've accepted that for decades. That's a good thing. It's not a bad thing, but we need to constantly make sure we're bolstering our nonprofit community's ability to continue doing this critical work for all of our populations.
Appreciate that. One thing about those pipelines, if you're at the beginning end and you're feeding upward, you got to keep people coming in.
Exactly.
And we think that this top of salary, this adjustment will put us vis-a-vis our peers at a competitive advantage, or just kind of where everyone else is, or?
So our providers did wish for more due to affordability. This is what we were able to recommend at this time.
What did they
Given
ask for,
other
just out of
priorities.
curiosity?
Twice.
Twice this amount?
Yeah.
Okay. All right, so that's sobering, but underscores why this is really important. And I think, when all things not being equal, when this goes on the list, I hope there's a way we can provide, when we talk about it at full council, some context that, go to Councilmember Alvarez, that this was not even what was requested. This is half of what the providers said they need to recruit multilingual therapists. First go to Co-Chair Alvarez, and then I'll come to Councilmember Lee.
Yeah, just for the benefit of my colleagues on the Education and Culture Committee, we have put a big asterisk on HHS's request, because under the guidelines set forth by our council president, which I respect and understand, the term new program is a misnomer. Based on the continuation of programs that are serving people, that have hired folks. And so we will try our best within the framework of a very large conversation and budget to underscore the point you just made, that there is a lot of need. We're doing the best that we can to fill it, but also that, these are not nice to haves. These are critical programs that are serving a critical function.
Appreciate that. Councilmember Lukey.
Thank you. This isn't so much a financial question or statement as it is a recognizing the need for consistency in behavioral health care and not having the students have multiple therapists in a small period of time. And I have not heard that being an issue per se within this program, but I have heard it as being an ongoing concern related to an MCPS contract with an outside provider. And so, is this going to help with that? And again, I don't know the terms of the contract that MCPS has with that other provider, or whether or not, because of the high turnover or shuffling of clinicians under that contract, if there may be a breach or something that could be corrected in that contract. But, that this request can assist with continuity, which is critical in the care of behavioral health patients.
Yeah, that is certainly the hope. It is a reality that just across the nation, there has been a very high mobility rate of clinicians in general because of the great number of new opportunities that they have for how they work and where they work, and salaries and compensation and the flexibility and all of that. Again, our providers have been doing this for a long time. They know the communities, they know their schools, they know how to recruit for professionals that want to do this work specifically, right, to be in schools. So it is certainly the hope that this will assist with retention as well. Yeah.
Great, thank you.
Thank you, Councilmember Lukey. All right, so without objection, we'll approve those adjustments. Your mic, Mr. Yao.
There's one more for Linkages to Learning. It's the operating budget impact for opening the school-based health center at South Lake Elementary School, $580,000, $364,000. The health center opened in fiscal year 24, but is not fully operational immediately. So this will, complete or continue those services.
Yeah, and just a quick question: what's operational today, and what would this add or complete?
So the this annualizes what has happened in the delay in getting it opened this year is really the state. So we have to be credentialed by the Maryland Department of Health as a school-based health center. We have to be credentialed by the Medicaid, by Medicaid, for us to be able to bill for services. And so getting them to come out for a site visit, making sure that we have everything ready, making sure that our lab waivers are in place, all those things has really delayed in us being able to do that.
And then this would also provide for the HERTH, the nurse and the technician. But are they currently there?
They're currently there.
This is just annual. This is
right. And our contract with Children's to provide the nurse practitioners, which is more expensive now because we just did a new RFP. More expensive now than it was last year.
Got it. Okay. Yes.
And I'll just clarify, this is a unique location where we already had the linkages to learning site here, and now it's becoming a full school-based health center, so most of the non-somatic stuff was already had a presence there beforehand. So that stuff obviously has been continuing with some enhancements.
All right. Without objection.
Okay, for fiscal year '25, the executive is recommending $8,628,195 to continue operations at the 6 high school wellness centers in the county. The table on page 17 of your packet shows the recommended budgets by site. There's a total of $6,060,141 that's recommended in the PYD program in Children, Youth, and Family Services. The additional cost in addition to the cost per site, there's also $353,920 for contract management personnel cost in PYD. The PYD operating expense also assumes a 3% inflationary adjustment to nonprofit service contracts. Data on student services by the high school wellness centers is attached at your packet at circles 31 to 32. And council staff recommends approval of the funding for high school wellness centers.
Appreciate that. Obviously, we had a discussion on the CIP side that was mentioned earlier about this back in March, but this is obviously for what's currently happening, and so turn first to Councilmember Sales.
I just had a quick question on how many students we're seeing across these new healthcare centers, new wellness centers. The 6 that we're continuing. Do we know how many students we're serving?
I think service numbers are in the packet. I don't have it.
If not available, we can definitely provide them after the session. Because there's numbers for the somatic side, and then there's numbers for the positive youth development side.
Oh, okay. Okay. Yeah, the positive youth development.
Yeah. Okay. And for the somatic side, at least, the number of students enrolled last year, or through February 2024, is 3,574. And the amount served is 1,159, and the number of counters 2,303. It's on circle 32 of the packet. I believe has the answers to those questions on it. And then there's info about the PYD side right below it, showing the amount of students served, which is between 250 and 450 per site.
Okay, thank you.
All right. I think without objection, we approve those.
For Bridge to Wellness, the recommended fiscal year '25 budget is $4,356,897, includes a 3% inflationary adjustment to nonprofit service contracts. They're currently administered by the Child and Adolescent School and Community-Based Services Program in CYF. And council staff recommends approval of this funding.
Bridge to Wellness, we love Bridge to Wellness. Any comments, questions from colleagues? Okay, so without objection, we'll approve that.
Okay. High school wellness centers, the table on page 18 of your packet shows 24 and recommended 25 budgets for each cluster project. There are cluster projects in the Kennedy, Springbrook, Paint Branch, and Watkins Mill clusters. The total combined HHS operating and personnel cost for high school wellness centers in fiscal year '25 is $997,578. Additional information about services and outcomes is at circles 37 to 38 of your packet, and council staff recommends approval of this budget.
Without objection.
Okay, and we're to partnerships. The table on pages 19, 20, and 21 of your packet shows contracts that DHHS administers that are delivered by public and private partners that are educational in nature and or involve collaboration with the school system. The contracts are ones that are included in the base of child and adolescent community and school-based services program and fiscal year 24 community grants. The fiscal year 25 amounts have not been finalized, but would presumably include, the 3% inflationary adjustment if approved by council. So again, if the committee has any questions about these, in addition, MCPS has also provided information about funding that they have recommended in their 25 operating budget that involves collaboration with county agencies, departments, and community-based organizations, and that's included at Circle 55 of your packet.
I'll turn to Councilmember Mick one moment. Have you all had the same issues? We've heard from providers about just funding getting out the door. Has that been an issue with these partners, to your knowledge?
I'll start. Getting out the door, no. It depends on whether it's a contract or a grant.
Sure.
So this was a kind of a bridge year for all of us with the Office of Grants Management. So there was some delay at the beginning of the year in getting some of that money out. From a contract perspective, it depends on when, at the beginning of the year, when we have out of our 750
I'll just give you an
contracts.
example. The Crittenden service, let me be very specific.
Yeah.
I met with them last week, and they had a 6-figure contract that had not been paid. So I have heard that there have been contracts that have not been fulfilled. And so I don't know if those are grants or contracts, or if both. I know we definitely had grants issues, and
Right.
and still have those. But on the contract side, your understanding is that that's not happening with these.
I've not heard from anyone that it happened, and I get phone calls
I'm
from
sure.
all of you,
Yeah.
from your staff, from the vendors themselves when they're not being paid, or a monthly payment has not reached them quite yet. But I've not heard that they've not
Okay.
that this level of concern yet, at least from them.
Got it. Yes. Go ahead.
I think there's also the Crittenden Services contracts administered out of my unit that money is flowing. The invoice comes. I personally sign those invoices. I approve them.
All right.
So that money's flowing. I can attest to that. And
Might be money from
give me a
somewhere
call,
else
Crittenden.
then.
There was a question and some advocacy around some additional monies that they had been appropriated as one-time only dollars to do some mental health work in schools as well. Some additional specialty mental health work. That was one-time only. And unfortunately, that was not sustained in this fiscal year's budget. So
Okay.
there may be some consternation about that piece. And then in terms of the Youth Safety Initiative dollars that Crittenden also gets, which is for performing expanded work based on the work they were already doing with the contracts in CAS. Ms. Treadvance has additional comments.
Yeah, so not specific to Crittenden, but just in general, I think oftentimes when there's some sort of disconnect is we also have to do our appropriate checks and balances and make sure that we're adhering to procurement guidelines. So oftentimes if there is a delay, it's either because services have been conducted outside of a contract being written in, or we haven't received any reporting to be able to confirm that some of the services have actually been rendered. So that's often a tough balance, to find that balance with providers, but that's something that internally we are having a lot of intense discussions at the department level to see how we can facilitate, better monitoring and working closer with providers to address some of those issues. It's administratively, it's just either with reporting limitations or making sure that we're also on our side adhering to procurement and contractual guidelines.
I appreciate that. Thank you for the follow-up. And that one just stuck out in my mind. Just since you're here, though, Mr. Hodge, the grants issue, I know HHS has been knee-deep in this, I'm sure, as others. Are we close to that being resolved and folks get, I was forwarded an email just yesterday that from a couple weeks ago saying that, if you've been selected, the stuff was going to come out in the next week or two, and it hadn't. I know there's various items, but can you just provide a brief update of where you think things are with OGM?
Yeah, we are doing much better now than we were at the beginning of the fiscal year, for sure. There's been some of the things we've had to work on is kind of the collaboration between departments and OGM. Because the OGM relies on the departments to have people who will look at the applications, subject matter experts who will agree to who wins that particular grant, and then it goes back to OGM for the grants, the grant agreement. And so some of the delays happen in that going across the street and back across that we've started to work out. So I think we have our process down now. I know that we're meeting with Raphael later this week to talk about some of the outstanding issues that we can address. And I know there's some confusion with some of the nonprofits as well about continuing funding that hasn't materialized, that we never expected to materialize. It's just a lot of the vendors got used to having community grants that just automatically happened every single year for 20 years.
Right.
And then when we moved over to the Office of Grants Management, that process changed, and some of them are off cycle, so there may be some delay in being able to apply for some of those. But yeah, we're much better than we were. There's still some wrinkles to address, but we're getting there.
Got it. I appreciate it. I'll follow up with anything specifically. Councilmember Mink.
I just want to note that one concern that I've heard from a lot of families in District 5 is about the need to expand the number of after-school opportunities there are for youth there. I know that's something that all of us are aware of and are working on, but I wanted to give you an opportunity if you could speak to how you're working on that.
That's a big conversation.
That is.
And I think across the county, it's one that pops up. It definitely popped up with the youth safety conversations.
Mm-hmm.
And I know that there's the out of school time work group being headed by, by Ramona's. I can't recall the name of Ramona's shop, but in collaboration with the community, yes. I know that work group is intensely working and bringing all of different players across the county to be able to come up with a strategic plan to enhance opportunities for after-school programming.
Right, and I know, sorry, go ahead.
I was just going to say that the joint ENC and PHP committee will be talking about that on May 1st, because they'll be reviewing the Recreation Department budget that has a lot of after-school programming in that budget.
Great, and I know that they were working on a study that we were hoping to see results from of where the needs are, and we haven't seen that yet. But putting that aside until later, I will just note that, hopefully as much as is able, that's being taken into account in this budget here, as much as is possible. There was one provider that I was surprised to not see, which is added to the list, which was Rec Mode, and I note that one because they're based in Wheaton, but one of the things that they've been working on is expanding access, because they've been so successful with some of our young people, finding ways to expand access to folks in other districts, and so there's a number of youth in my district now that are using that, and so. I'll just noting that I know the conversation's going to continue, but just wanted to note that for the record.
In particular to Rec Mode, I believe there are internal conversations that our director is having to have those discussions in terms of what could potentially be done. So just wanted to talk
That's great.
that. Yeah.
Thank you.
Appreciate that. Yeah, in out of school time, something all of us care about a lot, and we're going to talk about that more next week. And that strategic plan process that we've been talking about for a while, and we'll get into all that. So save some excitement for next week. All right. So I don't think there's any action here. This was just a report out. Well, thank you all very much. Appreciate it. Thank you for coming down, and we will see you, some group of this group, back on Monday. All right, with that, we are adjourned. Thank you.